You ask permission, then you expose. Okay. So if the swelling is here, how much should you expose?
Until the
Okay. Should at least expose the whole shoulder. Alright. Sebab you don't know, maybe there's other swellings elsewhere. Okay. So you expose. Katalah for example, dah expose. Alright. Okay. Next, you sit down. Okay. Put the patient on a comfortable position. You can put a pillow, macam you buat rheumatoid hands kind of examination. Alright. Then you sit down and you can start. Alright. So for example, you have this kind of swelling. Okay. So you describe lah. Alright. So side, katalah sini you have a swelling over the extensor surface of the forearm, measuring whatever size. Shape is oval in shape. Okay. Surface smooth. There's no nodularity seen. Then if there's any surrounding changes, okay, if there's erythema, katalah for example kita tak ada erythema, there's no dilated veins, then you can mention that, right? Okay. Next. Okay. And temperature. Okay. So you palpate, okay, back of hands, feel for any difference in warmth compared to the other side. Okay. Right. Then you palpate the swelling. So this is swelling. So you palpate, okay, over the sphere, ni at the side, okay, for any tenderness. Before you palpate, what do you need to do? Okay, you ask the patient if there's any pain. Alright. Okay, then you palpate. Okay. Next, you want to look at feel for the surface tadi. If there's any irregular surface. Okay, so for example, this smooth. Alright. Feel for the consistency. Alright. Okay. I get you to palpate the consistency. Okay. Right. Boleh? Okay. From swelling. Okay. Then you feel if there's fluid or really? Dia ada satu-satu. Okay, macam dia fit. So 2-1.
Cystic.
Yes. Alright. Okay. Next, you feel for fixity. Alright. Okay. Sorry. Tadi kalau katalah fluid, then you want to know whether it's pulsatile, arterial or not. So kalau pulsatile, obviously you press and you feel whether it's bounding, right? If it's there's pulse. Okay. Then you feel at the side to see whether it's expands. So usually, if vessel it can expand, right? Then feel for thrill. Okay. So if you feel there's a thrill, then it's like this vessel. Next, you feel for fixity. Okay. So fixity is atas bawah. Okay. So number one, you pinch the skin. Okay. Katalah you can pinch the skin. Buat kat manusia lah. Sorry, I can pinch the skin. Okay. So you can pinch the skin. Okay. So that means the swelling is not fixed to skin. Alright. Next layer is
muscle.
Okay. So you have subcutaneous tissue. So that means your fat and things like that. Then you have your muscle. Okay. So how do you know if it's overlying the muscle?
Move with the contraction of the muscle.
Okay. So what you do is you have to contract the muscle that's underneath that swelling. Okay. But you need to know what muscle lah, so that you can contract that muscle. So if this is extensor, right? So what do you need to do?
Extend.
Extend. Flex.
Extend.
Dia extend lah sebab
Extend lah, dia extensor.
Right, so you extend. Okay, tapi extend je tak cukup. You need to ask the patient to extend and you have to resist. Extend. Okay, push against my hand. Okay, then the muscle will contract. Okay, alright. So for example, after you do that, okay, if the swelling is overlying that muscle, okay, again, sentuh, that swelling will become more prominent. Okay, because it's you extend it and it will be more pronounced. If the swelling is underneath the muscle, then it will disappear. Huh? Okay? Betul?
Betul?
So that's one. Okay, next you do that again. Okay, after the swelling is more prominent now, then you move the swelling. Understand? Okay, how you move the swelling? You move vertically, horizontally. Okay, you see if it moves. If it moves, that means it's not stuck to the tendon or muscle. Okay, if it's there, that means it's stuck. Okay, boleh? Okay, okay, right. Border and margin wise, so once it's pronounced, you can feel the swelling there. You can go underneath that swelling. Okay, if you can actually feel the whole border, it's okay. But if it's you can't palpate, it's quite broad. That means you can't feel the extent of the margin. That was tadi macam I cakap. So if it's you can pinch, that means it's underneath the skin. If you unable to pinch the skin, that means it's just underneath the skin. Okay. Then if you contract the muscle, it becomes more pronounced. That means it's above. If it's mobile, that means it's in between the soft tissue and the muscle pain. But if it's not mobile, it's stuck. That means it's stuck to the muscle. If it disappears, that means it's underneath
Under the muscle.
The muscle. So underneath muscle means either it's bone or it's just above the bone, right? Okay. Okay.
Understood.
Okay, then you can do your special test. Okay, so transmissibility. So what you do is you roll. Nah, I selalu lupa bawa kertas. Tadi tak sampai di kertas kosong. Oh, thank you for sacrificing. Okay. Obviously, for exam, bring cardboard kind lah so that dia tak penyit dalam poket ni. So, tapi pun besar lah. Kalau you percaya kecil. Okay. So what you do is you do that. Okay. Then you shine your torch there. Okay. Then that area will shine. Provided this is smaller lah. So it should be smaller. You shine the torch. Okay. Right. Then slip sign. Okay. So for example like this. Okay. You try to pinch. Then I can pinch the skin. I can pinch the swelling. So most likely this is not lipoma.
Not lipoma.
Okay. But if you pinch and it runs away, and then you see slip sign is positive. Reducible. Okay, reducible usually tak ada lah. Tapi I'm sure you know how to do reducible for hernia, right? Okay, next is Tinel sign. Okay, so you can tap proximal to distal. Okay, proximal to the swelling, tak ada apa-apa. Tap the swelling, then patient have radiating, so that means most likely this is. Then you tap to distal. If it's there, that means this swelling is throughout, right? Okay, but if you tap distal dah tak ada, so that means it's secondary to this swelling. Or maybe something the nerve is around that area. Okay, that you tap.
Ting 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 ting.
Okay. So move, kalau katalah swelling is here, so what you want to move is the joint above and below, right? Okay, so you move the wrist joint. Okay, ask the patient to extend, flex. Okay, radial and ulnar deviate. Okay, elbow, extend, flex. Okay, then you do supination, pronation. Alright, so supination, when you test, you need to fix the arm. Okay, I know orang ada yang buat macam ni. Okay, when you do this, your shoulder can turn. Okay, so for example, you turn your elbow, your shoulder to pronate. Boleh kan? Turn your elbow to supinate. Okay, shoulder, sorry. So if you want to check just this, you have to kepit your ketiak. Okay, fix it like this. Then pronate, supinate. Okay, right. Okay, so that's your range of motion. Okay, then if you're okay, if the patient cannot do it, then you can test it, right? Right. Okay, so for conclusion, you check your lymph node. So if the swelling is here, then the nearest is axilla. Then you check your neurovascular. So that means radial pulse, ulnar pulse, brachial artery.
Brachial.
Alright, then sensory wise, if the swelling is here, which nerve do you want to test? Okay. Alright, so you can test your radial. I'm sure, I hope you guys know how to do it. If not, I tell you how to do it. Okay. I think that's about it. Okay. Any questions? Hello? Yes, Zul? Saya kat OT.